I'm Anne Holdoway, a consultant dietitian. I've been qualified and working in dietetics for 30 years now. My career pathway has probably gone down lots of little avenues along the way, and I feel at the moment I've sort of brought all that together as a portfolio career, drawing on all my skills and expertise that I've built up over those years. Now I work for Dorothy House Hospice in the southwest of England, just based outside the beautiful city of Bath, where I care for patients with palliative and life-limiting conditions. On another day I might be lecturing at a national event on nutrition and dysphagia, or nutrition and malnutrition in elderly care. Another day of the week I concentrate on my doctorate, and another day I do private practice specialising in gastroenterology and oncology. When I first qualified in 1986, I was very much considering a lifelong career in clinical dietetics, whether that might be in the community or in the hospital. And I worked for a couple of years in clinical dietetics in London teaching hospitals, and at that time I had a friend who worked in industry, and he just very much felt that some of my skills, particularly in promoting a change in diet to somebody, which is based on selling skills and marketing skills, could be put to good purpose in the commercial sector. And that got me thinking, really. And so 2 years into my clinical career, I applied for a job with a medical nutrition company, was successful in securing that, and that started me on track with a career in industry that took me from being a clinical dietitian in industry to then into marketing and product management, and then into international product development. When I moved back from the commercial sector into a healthcare job back in a hospital based in Bath, there was a degree of scepticism about what I'd learnt in industry and whether those skills were transferable to the clinical setting. And within 6 months, we'd done a major audit that had won a regional audit prize that really transformed patient care in both surgery, ICU and gastroenterology. And to me, that was proof that skills you learn in industry are transferable to a healthcare setting. And many of those skills I learnt were the business skills, which I think can really empower you to go back into a clinical setting to actually help the workforce and those around you to develop in their clinical roles. For me, having had such a diverse career over 30 years that has developed my skills in both research and education, the private sector, industry and the NHS, the thought of being in one place 5 days a week, 9 to 5, does actually fill me with horror. I realise that sort of work situation can really suit some people, particularly if they've got family or other family commitments that they have to contend with, that they probably want that security and regularity with their job. But now my children are a little bit older, my husband's probably used to me zipping off to places. I really thrive on every day of the week being different.